modality is cervical traction, motorized cervical traction. We've got our patient in supine. Once we got them in on the table, we want our pads to be touching the styloid process or the mastoid process. We can rotate these in or out to make the patient more comfortable. We'll just have them let us know when it's comfortable for them. We also have a strap that we're going to just secure the patient's head to the device. Once we've got this, we want to just make sure our table is in the locked position. You can see there's a knob. We need to lock them in position. This is going to allow friction up through their back, allowing friction to be generated when the cervical traction begins to pull. Once we've got them here, if you come over to your device, there's a release or a rope release button. If you hold that and pull out, that's going to give you slack to be able to hook up your rope, and then same thing to take the slack out, just push the button and then it'll take the slack out. Once we've got them here, we can also take the table up or down to increase flexion or extension of the neck depending on what pathology we're trying to create traction for. Once we've got there, we're going to do cervical traction. So as you can see on the screen, there are icons that you can just follow right through. So we're going to do cervical traction. We're then going to go into edit so we can edit all of our different steps. One of the things we want to remember on cervical traction is if we come to the speed, we want to try to keep it low. You can do 30, 50, or 100 for cervical. We're going to do 30. This is going to gradually pull them to their total pressure of cervical traction, and it's not going to make it uncomfortable for the patient. So we're going to leave that at cervical. We can also come to our time. Time for cervical can be anywhere between 20 and 25 minutes, and so for intermittent, for static, 10. It can, so for just our demonstration, we're just going to show you how you can just put in the time of a treatment plan of 25 minutes. We can also switch the steps of how long it takes them to get to full traction. And so if we go in, we can switch to the steps, and that gives us one step to just get up to full cervical traction. Once we get there, we can come up to our edit, our minimum and maximum levels of pounds. Cervical traction, the maximum pounds per pressure that you want is 25.
Minimum is 1/3.
And minimum is 1/3 of that, which would be
8.
Yeah,
Right.
like 8, we'll say. Once you've got that, you can come back to the home or back to the next page, and then you can hit your treatment time. Once we've got our treatment time, you can do that. That's also wants to be 3-to-1 ratio, so we've got it 60-to-20, or we can go 30-to-10. Once we are there, we want to just make sure and look over all of our steps to make sure we are in the right place. And once you are ready to start, you're going to just hit the start button, and that is going to start your treatment time. And then just monitor your patient throughout the treatment, make sure they're comfortable. You also want to give them a kill switch. They have a kill switch that they can push at any point. If they feel uncomfortable, they can hit it and it will stop the treatment altogether.